The fear of the deadly Delta variant of COVID-19 is now the beginning of caution in Nigeria. The federal government has shut various parks in the Federal Capital Territory, FCT, Abuja, over fear of resurging COVID-19 cases. The head of media and publicity of FCT Ministerial Committee on COVID-19 Enforcement, Ikaruwata, said the administration has mounted surveillance at recreational parks within Abuja to ensure compliance with safety protocols. As a sign that the fear is justified, the country recorded 1 death and highest daily infection in months on Friday. 10 states and the FCT recorded 317 fresh cases of the virus. Babajide, this is not looking good at all. No, still, people are not taking this serious, but it's ravaging us.
It is, and I think 317 fresh cases in 1 day, the highest in months, should alert us that there is a trend.
Surge.
Yes, and it's a dangerous trend. There is a surge of this highly transmissible variant of COVID-19, and we have to be very careful. And you know, the most dangerous part of all, the most dangerous reality in all of this is that even these figures do not reflect reality
at all, because
13 states, according to NCDC, 13 states have not been sending any report to the NCDC, and they have not been testing at all. So if they had not been testing, and we are coming up with 317, if those 13 states that represent close to half of the Nigerian states, if they begin to do testing, definitely the figure will be higher than this. So we have a situation in our hands that will suggest to any discernible fellow that this virus is running far more rampant than we acknowledge, because they are not testing. In the last 6 months, testing has gone down drastically. For example, between January 10 and April 11, we recorded 735,573 tests. But in the last 3 months, April 11 to July 11, we've had 521,738 tests recorded, which, as you can see, is a margin of more than 200,000 deficit. So the rate of testing is going down. When you bounce the last 3 months against 6 months ago, the rate of testing is going down. More states like Abia, Adamawa, Anambra, Bauchi, Benue, Borno, Ebonyi, Kebbi, Kogi, Niger. Kogi is not even a surprise anyway. Niger, Taraba, Yobe, and Zamfara, they are not testing at all. They are not testing. So whatever is going on in those places, we have no means of knowing. Which means that these figures definitely would be far higher if we were to allow testing to happen in all of these states.
When we were told that this Delta variant is deadlier, far deadlier, and some people, they don't know, you just find that, after a brief illness, they're dead now, because a lot of people are not paying attention to this third
the symptoms from what we have had are not as severe as the other variants. And that is why we need to be more careful. It is better to err on the side of caution. And I think that's why I think what Abuja authorities did was quite good. If you watch what is going on in India, you discover that more people are dying. And we cannot just sit down to say because we have survived the first wave, the second wave, then everything is normal. We still need to be more cautious. We need to take precaution, because there's nothing unique about Nigeria that we cannot be ravaged by the Delta variant. So I think we need to be more careful, and this comes to personal responsibility. Even though if government is not testing and all that, people on their own need to take personal measures, safety measures, to ensure that they don't contract the virus.
Abuja, what do you call it? Hospitals, Lagos, Abuja, we've noticed a kind of surge in terms of people coming to complain.
Yes, and that's why I was told about the case of a woman who already had received the 2 jabs, yet she's been on oxygen for over 2 weeks. So it means that there's no remedy, there's no best way to handle this matter than sticking to those
protocols,
biosafety protocols. So we stick to them. We protect ourselves. When we are going to public functions, where there are going to be many people, then we use the face mask. Then you don't have to shake hands with people. You see President Buhari and other people, when they meet, they don't shake hands. It's just arm-to-arm greeting. No. Nobody will say you have not greeted them, now. But we still embrace and do all sort of things. Parties are still overcrowded. People believe that this thing has gone for good. It has not gone. It has not gone. We just need to be responsible and take this disease seriously before it kills all of us.
And when you look at how people will tell you that because of the poverty in the land, poverty rate, that they have to go out, they have to go about their daily chores, and you find out that people still don't observe the non-pharmaceutical interventions that have been laid down, but these procedures that have been laid down by the government.
People need to go out for survival. But why do you have to take the risk? Because the most important thing is your life. If you are going out to look for food and then you are not alive, how can you even think of going out? So I think there is no excuse for people not to prevent themselves from infection. Interestingly, the measures are not expensive. You can buy, the nose mask just 100 naira. So I mean, it's not expensive. So, and then sanitizers. Clean your hand. You can even do homemade sanitizers.
Maintain social distancing.
So maintain social distancing and ensure that I think there are very cheap things that can keep us alive. And I don't think there's no excuse for one to go on that kind of plunge. It's almost like self-suicide. We need to take precautions, as far as we can. Unfortunately, some public institutions have relaxed. If you go to some secondary schools, primary schools, when you go and drop your children, months back, they used to have washing basins. Even churches these days, you discover that they have discarded, some of these things. So as if everything is normal. So I think we need to take more precautions so that we can save more lives.
I think the responsibility in some countries is now in your hand. Yes. The United Kingdom opened officially July 19th, and they are placing the responsibility in the hand of individuals and saying that, look, we've done our best, that COVID-19, I think, is just part of our life now.
It's looking like diabetes.
We can't pray it away.
It's looking like tuberculosis. It's looking like sickle cell anemia. Ailments that you can't simply take a drug and expect them to go. You just have to manage those ailments, and it's the same thing with COVID-19. Now it's looking like something that has come to stay, but we have a choice to protect ourselves and ensure that we don't get defeated by it. If we would do the needful, we can live happily and healthy in spite of the ravages of this virus. But Nigerians are already tired of the measures that were put in place to save us. Look at those little buses that Faleke distributed to people. Those buses by nature are very small, yet we still pack people in them like sardines. And
is that the major form of transportation now in Lagos?
Everywhere now, especially in this Ikeja area. There are so many, you see them everywhere. Even in inner community road, inner city roads, you see them, So, but the point I'm making is they pack people full of those vehicles like sardines, and it's not supposed to be like that. I keep praying that, and God knows why he decided to spare our lives the way he has done, because we are not close to the Americans in terms of health care infrastructure. But see the way the Americans, they are even dying, even now. Joe Biden described it as the pandemic of the unvaccinated, and that the people who refuse to get vaccination are the ones that are dying.
Just trying to cajole people to come on.
Yes, because
to
get people to take the vaccine, because the vaccine will most likely help you to not fall sick, but does not insulate you against infection. That is a fact, because all of the vaccines, there is no one that is described as 100% potent. You see them, they have different degrees of potency against this disease. And I think that because the world was not prepared to wait long enough to produce.
It was done in a hurry.
We were in a hurry. Now we have vaccines that do not guarantee complete protection. That's why even people, you can have 2 jabs and still fall sick. You can have 2 jabs and still get infected. You know? So it's a terrible thing. But Nigerians have to realize that it pays to do everything to stay alive. Because when you are alive, you will be able, you know that your future is brighter. But if you do not do your best to stay alive, then you won't be in position to confront the challenges that are standing between you and greatness. So this is what Nigerians need to take seriously.
Well, all of those presidential committee was dissolved, and we didn't see this third variant. We didn't see it coming. As in, even the federal government of Nigeria, there was this tendency that, look, okay, everybody, we're getting kind of relaxed.
I think we need to take more drastic measures. We got 3.94 million doses, and almost exhausted now. And if we are talking of Delta variant, are we sure there is not going to be another variant in the next few months ahead? So our scientists in the academic community, the Ministry of Health, they need to look for local initiative. I know there was a report about the Nigerian vaccine, but we are not sure of when it's going to be clinically tested and can be acceptable to the world. But we need to begin to think of our own local solution, because like Babajide said, this problem is going to remain with us for a very long time, and I don't think we should keep on depending on other countries for solution. We need to look for local initiatives, get our scientists to do more research so that we can find a permanent solution to this challenge. In the next few months, we may have some other variant that may be different from this particular species. So we need to really work harder, at the level of the Ministry of Health.
I'm worried about the rate of infection in some of the countries that Nigerians love to go to. America, the UK, after the India, yes, China, India, Brazil, South Africa. I'm even talking about countries that we saw it go down. Suddenly, there's a spike now, and these are countries that Nigerians go to a lot, like the UK, for example. The UK
has the next bus stop.
I don't think that there's a country, maybe apart from Dubai, that Nigerians like to go to, like UK. But you have a situation in which it's gone up, maybe because of the tournament that was organized. And, a lot of them inside Wembley, they were not wearing any mask. They were just reckless and jubilating.
Okay, the head media publicity of FCT Ministerial Committee on COVID-19 Enforcement, that's Ikaro Atta, is with us now. Thank you for joining us.
Thank you very much, our wonderful big brothers there from the TVC family.
Thank you, my brother. How is it going?
Oh, thank God, it's tough again, getting signal that we may come to the trenches.
This problem appears to have returned, and on Friday we saw frightening figures suggesting that this thing is rising again. We had more than 300 cases, the first time in months that we've had fresh cases that high. What kind of challenge does this pose to you, especially in the seat of power, having to get people to begin to respect those biosafety protocols again?
Thank you very much. You know, from our own end, Abuja and Lagos, I'll call them twin brother in the issue of COVID-19. They are key destination for arrival point for many persons who are coming into the country. If you look very carefully, you will observe that most of the flights are flying into Lagos and into Abuja, and some of them who are even coming in have some connecting flights between both cities here. So for us in the city, it presents a very big challenge, particularly at the time when some persons are already having what we term a COVID fatigue. If you watch what happened yesterday in Australia, I think in Sydney also, persons are going out on the street protesting that they cannot go into further lockdown, resisting what Bob Marley called resisting against the system. I think from our own end here, we are watching it keenly, and we are not very comfortable. We are not very comfortable. Series of meetings have been held. Meetings are currently being held, and I'm very, very convinced from Monday we'll start holding series of meetings there, hoping that we can actually slow this negative and fearful tide of the Delta variant.
I don't know how you intend to carry out your responsibility, because a lot of people will tell you that, look, they have to go out and eke out a living, that on a daily basis, that you cannot stop them, especially in the marketplaces, in the parks and everything. Most of these things are attached to the survivor.
Yes, I think from our own end, we did something during the Salah break, which was largely successful by getting the parks shut, because we know very clearly that Tuesday and that Wednesday the parks will be extremely overcrowded. So we got the main parks shut for those 2 days. Even the other parks, you know, what we observed is that persons I came into Abuja, and some within Abuja wants to go out, enjoy the Salah. We have to get the parks largely shut. Almost all the parks were shut. Almost all the parks were shut. Just that where we saw something that we really don't like was where some persons, after we shut the Millennium Park, shut Unity Fountain, shut Jabi Lake Park, we saw people not willing to go home. They were not willing to go home. They were determined to enjoy Salah. So they gather in nearby open spaces like trees in their thousands. And on that point, you can't chase people from actually staying where they want to stay within the city here. We did that one during the Salah, and it was largely successful. Now that we are coming back, the schools will likely soon be resuming, although most schools in the FCT are on break now. The schools will likely soon be resuming. We'll have people who may likely not want to put on the face mask, who may likely not want to use sanitizer, who may likely not want to even have hand washing points. So I believe strongly, which I said during several meetings with the steering committee as well as the minister office here, that if we can enforce the issue of the health protocol, that will help us more, because to lock down the city, to lock down the nation, for me, it will be very, very devastating, because we can't, I don't know how we'll manage now to go back to palliative policy, which we know how it ended during the NSAS and the kind of perception the public had about it. So I believe enforcing that. But what I think is also cardinal is to actually go into intense advocacy, so that the people will own the process. And also, one very important group I also share that we must engage and re-engage are the clerics. They are too essential to this process, because as far as we are concerned, if you look at the vaccine, when the vaccines came in here, some persons did not take it. And when we did our own survey, many did not take it because of the position of their religious leaders on issues of COVID-19. So many stayed away from it. And that similar survey in all the states shows that the reason why it wasn't taken largely had to do with the issue of religion. And most times, when when COVID-19 suffers severe setback, from all the surveys conducted, religion plays a very key and sensitive role beyond some other political suspicions here and there. So we need to engage the clerics from both monotheistic faith, Islam and Christianity very much, get their buy-in. Like what we did during the Salah, we got the buy-in of the leagues of Imam and Ulamas. So throughout the mosque period, we saw real compliance in most of the mosques in the FCT, although in few areas in the far suburbs, there was very poor compliance, but in the city center and satellite town, we saw heavy compliance. So I think we need to engage the clerics and engage them more this time.
Well, yeah. How is your relationship with the law enforcement agencies in terms of enforcement of COVID-19 protocols?
No, it's really very beautiful. You know, our team, the COVID-19 enforcement team, has men drawn from every agency under the supervision of the police commissioner for the FCT. That is very key in our team. You have personnel from the police, very large in number, personnel from the DSS, personnel from immigration, personnel from civil defense, personnel from the Abuja Environmental Protection Board, personnel from the, the NDLEF in our team. It's a full loaded, even the AMAC Marshal, we had a full loaded team. So I think it's all about, we are the only one or two of us are the few civilians in the team. The rest are all security personnel.
Worried that churches appear to have simply brushed aside these safety protocols?
Hello?
Are you not worried that across board it will seem like churches have simply brushed aside these safety protocols put in place by government?
Yes, I think let's give it to them. If you look at the churches, the one I observed this morning around the city, because even tonight you could observe joining you from my car, because I've been going around, says the Orthodox churches, if you go around, there is the heavy compliance in the city center. When I say heavy, I mean very heavy compliance. In some other churches where we have also made appeal, we have also pleaded with some persons very strongly. I think those ones are the ones whose religious leaders at the point of headquarters have made comments that really describe COVID-19 as either being antichrist, as either being ungodly, as either being some kind of ploy by some persons to actually change the world order. It is in those churches we have some challenges, but even within those churches,
thank you. Thank you so much. The head of media and publicity of FCT Ministerial Committee on COVID-19 Enforcement, Ikaro Arthur. Thank you for joining us. Thank you.
Thank you very much, sir.
Yes, Jide, this church thing is very funny. Yes. Because when Daddy Gio has declared, or our general overseer or our founder, if he has declared in church that, look, this is a ploy for the Antichrist to spread its propaganda, or your body is the temple of Christ, if you get this thing, that you are bringing something to yourself, you know, and a lot of people, they've been in that position. If they have 200,000 members across the country, you are short of 200,000 members, almost 200,000 members, because these people tend to comply with to whatever that the GO says. Absolutely.
Yes, it's not just that the GO, the church leaders generally, even for church leaders who do not have more than 100.
I'm not referring to one person.
That is the way a particular church leader is addressed.
No.
When you say that, did you? Everyone would think you are referring to Baba.
No,
and Baba has been very dignified. This whole thing, he's not happy that a lot of the programs cannot go on the way they used to. For example, you can't do the monthly vigils. Yes, what they call the Holy Ghost service. You know, you can't do it, but
I know for sure
the president is yet to lift the curfew
that begins 12 midnight to 4 p.m.
Yes, it's yet to
and 4 a.m.
And as far as that curfew is in place, you can't do a vigil. So I know that he's not happy about that, but he also realizes that, look, the Bible preaches that we respect constituted authority.
Yeah.
So, and whatever is due to constituted authority, you give to him. Your taxes, your obedience.
Yeah.
You know, so he is very careful about that compared to some other church leaders who have been abusing the government and behaving as if it's the Nigerian government that brought
COVID-19.
this whole thing. Whereas in big countries of the world, even when Trump wanted to say churches, go back, there were church leaders who told him, no, we will not go back. We will not endanger the lives of our congregation. They refused to listen to Trump. They saw that he was trying to use that.
Well, they're not even forgetting that some churches, look at the visuals we are seeing now, look at how they're keeping to the safety protocol. We must give it to some churches across the country. Look at the way they are seated, look at the nose mask, look at the distance, and this is not like as if this is the maximum capacity they can get the auditorium, but there's a way, there's a way.
There are many faith institutions that still keep to the protocol, and even some even organize their vigil online. I think Redeem does that. So it shows that not all of them, share the same perspective that there's nothing like COVID-19. But for the few that think there's nothing like COVID-19 and all that, I think it's not the correct perspective. Because even when you read the holy books, God warns us on several occasions that when there is a plague, you stay away, you stay at home, and take all the normal protocols. Yeah.
We just hope that at the end of the day, we'll be able to just keep to the protocols, safety protocols, and when people are going out, always remember to wear your face mask and everything. It's something that we have to live with, and as you said earlier, this it's looking like it has come to stay, like malaria fever.
Or diabetes.
That's come to stay.
No cure for diabetes.
There's nothing we can do about